Okay.
Yeah. And you're recording, yeah? Good evening, everybody, and welcome to tonight's meeting. My name is Rob Miller, and I'm the director of the Cuba Solidarity Campaign here in Britain. And tonight's meeting is called Responses to the US Election, What Now for Cuba? And we're really honoured and delighted to welcome His Excellency José Ramon Cabañas, the Cuban ambassador to the United States, who is joining us live tonight from Washington, DC, or good afternoon in Washington, of course. And he's going to be giving us his reaction to the election results and what it means for Cuba and the Cuban people. And I'm also very pleased to welcome two members of Parliament who have supported us for many years. I'm very pleased to welcome Navendu Mishra MP and Paula Barker MP from Wavertree. Nav represents Stockport, two parliamentary constituencies in the northwest of England, for those of our audience who are coming, who are with us from abroad. And also, although not a formal panelist, I'd like to acknowledge and welcome the presence of Her Excellency Bárbara Montalvo Alvarez, the Cuban ambassador to the UK, to this meeting. I know Bárbara will say a few short words at the end of the meeting. So just to go through the format of the meeting so everybody is clear, we've had over 500 registrations this evening, and we're streaming this meeting to YouTube as well as to Zoom. I'm going to be asking Ambassador Cabañas a number of questions about obviously the election results, but also Cuba-US relations, the blockade, and his time in Washington, which has been an incredibly interesting period in the history between the two countries. And then through the evening, I'll ask Paula and Nav to come in at certain points to make some contributions. We'll also, after that, be showing a wonderful short video from the fabulous actress Maxine Peake, who has just sent a message of support for our campaign for the Nobel Prize for Cuban doctors. A number of people have already sent us in questions in advance, but if there is time and you want to post questions to the ambassador, we'll be able to take a few questions at the end of the evening. And if you want to post questions, please post them in the Q&A box if you're watching on Zoom, or in the chat box if you're watching on YouTube. And we aim to finish the meeting around 7:45 this evening. So first of all, I want to move quickly to our very special guest. I'd like to thank you, Mr. Ambassador, for joining us today. We're very lucky, we're honoured that you're with us. It must have been an incredibly busy period for yourself. I'm sure there've been many people hoping to speak to you over the last week. During what has been a very interesting time in US politics with the election there, which has been closely followed by people here and I'm sure around the world. But I want to ask you a number of questions about the results. But before I move on to that, could I ask you a bit about your time as ambassador in the United States? You started your mission in Washington, I think, in 2012. So you've been there quite a long time. You've seen many changes in policy and, of course, presidents. This is now going to be your third US president, we hope. And you, of course, were there at the time of the opening, the formal opening of the embassy, when it became an embassy again in 2015, after the rapprochement between Raúl Castro and President Obama in 2014. Can you tell us a little bit about the improvements you saw under Obama and what it was like at that time, and particularly when the embassy opened, about your hopes and your expectations at the time under Obama?
Well, thank you, Rob, and your audience, and thank you, the whole campaign, for organizing this and for inviting us to attend. My respect to both members of Parliament, of course. My regards to Ambassador Montalvo, an old friend. Well, to react to your first question, as you said, it has been 8 years with ups and downs. When we arrived here, November 2012, I came as a head of the, at the time called Cuban Interest section. I mean, technically speaking, we were part of the Swiss Embassy, as the Swiss government represented us in Washington, the same way they did with the American office in Havana. Since then, well, we started a process of conversations, mainly during the second term of the Obama presidency. We discussed before the announcements several issues, and most of what happened afterwards is public. The many meetings we have, official meetings, presidential delegations on both sides. And when people ask which were the preconditions, if there were some, for that dialogue to happen, there were basically two, which was mutual respect and reciprocity. Observing those principles, we were through the process. It didn't come overnight. If we were able to make the announcement in December 17, 2014, it was basically because you had historic processes moving forward from the point of the way American politicians and the American people look into the so-called Cuba policy, how it failed. It basically failed. How much money was invested before trying to overthrow or trying to produce regime change in Cuba for no outcome at all. You have processes that were through the American businessmen. I mean, the way they sensed the possibilities of doing business in Cuba, the many changes among the Cuban-American community in the United States. And one important factor was the way Washington was viewing, the kind of relationship they could establish with Latin America and the Caribbean region as a whole. And for many years, that region was telling the United States, you know what, we are a community. If any of us is missing, then we don't have a community. And Cuba should be part of any kind of regional conversation. Then that's why in the last Summit of the Americas, before the one that took place in Panama, the message was basically, if the next time Cuba is not coming, then we don't have a summit at all. Those are, in general terms, some of the reasons and the things that were happening for many years before the announcement. Now, the Obama administration, well, they arrived to several conclusions from not only the president himself, the White House, of the State Department. If you check online and if you check on archives, you will see even reports from the intelligence community in the United States say, well, Cuba is not the enemy. There is a chance that we can get involved in a process of conversations as it happened. In the media, you will see many times that some people refer to the process and some people refer to the agreement as a one-sided deal or things like that. It's not an exact description of what happened. We were able to sign 22 MOUs, and when we say that many, consider that the first semester of 2015, we were mainly focused on reopening embassies. And that was the main subject. Once we announced that on July the 1st that year, then you have the second semester, 2016, and that's it. Well, in that year and a half, we were able to not only to engage, but also to deliver. And we delivered 22 MOUs that cover a very wide range of subjects, from law enforcement to climate change to environment, agriculture, health, you name it, 22 of them. Now, reopening embassies. If you ask me to describe the sentiment on both sides, I think it was a sentiment of joy on both ends. We all have where Ambassador Montalvo was in Havana at the time. She witnessed the way people went to the street to celebrate. Because if you ask any Cuban, no matter if it's someone, the majority that supports the revolution, but or the few that they don't do that, but all of them will tell you, and they said at the time, you know what, finally United States realized that we are an independent country and we deserve to be treated with respect. At least I would say that that's the average opinion on our side. And in the United States, you have had, I mean, the majority of the population in this country have been trying to, or at least supporting, a different kind of relationship with Cuba. When we had our own celebration on July the 20th that year in Washington, I can even tell you the neighbors, families that live around, for them was something personal. The emotion of seeing the Cuban flag raised for the first time in so many years in Washington, D.C. Then it was a celebration. It was a celebration for the Cuban, at least a long percentage of the Cuban community in the United States, for many Americans, citizens on the street, that they had the feeling that they were attending a historical event, as it was. And then since that moment on, we continue. I mean, in total, we had in Washington, D.C., roughly 40 plus Cuban delegations in that year and a half. Largest amount of American delegations visiting Cuba. Well, we welcomed President Obama in March 2016, who was accompanied by the largest congressional delegation that ever accompanied a president to events like that. And we have people from both parties, because now, usually when you are close to elections, you have people relating that fact with one party or the other one. We have to say that policy has a bipartisan support, and that was one of the reasons why President Obama was able to move forward. Then it was, to summarize, it was a very productive time. And as I said before, we not only engage in negotiations, but we deliver on both sides.
Well, thank you very much. It was certainly a great period of hope for the people of Cuba and the United States. I remember the flags, the Cuban and the US flags together in the streets of Havana. And many people sometimes believe the Cuban people and the American people, for some reason, dislike each other, and that clearly is not the point, not the issue at all. Both sets of people want closer relations, in my opinion. So it was a great period of hope, I believe, under Obama. Perhaps the hope didn't materialize into as many changes as we would have liked, but it was certainly a very different time to the period following. So when President Trump was elected in 2016, of course, it changed things considerably. Can you talk a bit about that period and about the impact of Donald Trump's administration, and obviously the anti-Cuban measures that have been ramped up so much over the last few years?
Well, yes. If we check on President Trump, I mean, before becoming president, as a businessman, his main statements when he was a pre-candidate on Cuba, they were not negative statements. Even when he was asked about the reopening and reestablishing bilateral ties, diplomatic ties, he said that, I mean, you can quote from him, he's saying that he considered it was something positive. Now, with the time that approach changed, if we remember early 2017, you had 6 months in which the new administration basically took no new measures in regards to Cuba, until the new Cuba policy, I mean, the presidential decision on the new policy was taken in June that year, 2017. But in the middle, you had a process of different officials in the administration and Republican leaders discussing how to do it and if do it or not. And we know that as part of his cabinet, he has several members advising him not to deteriorate bilateral ties. the decision came. You have seen the news about who was pressing more for that. Some American politicians of Cuban origin, they were involved in that. And the equation was basically, you know what, if you put pressure on Cuba, then you get more support from Florida for your aim to be reelected. It's basically the equation that was written. And then since then, we saw a series of events. You remember immediately after he was elected, then we had that campaign about the so-called sonic attacks. No one in the United States have been involved with the subject from the very beginning. I can tell you, no one can describe exactly what happened. And we have said, well, we are forced to deny fatherhood and you don't have a pregnant woman in the room. And this is difficult to say for them what exactly happened. They have been looking for arguments in terms of if this weapon, they call it, or that other weapon was used. Arguments that no serious scientist in the United States or anywhere in the world can support. But we were under that campaign to deteriorate bilateral ties for several months. You remember in May and October in 2017, several Cuban officials in Washington were expelled from the country. And then most of the 2018, they were deteriorating bilateral ties under that argument. Then suddenly, overnight, they changed from that argument to the Cuban presence in Venezuela and the so-called Cuban presence in Venezuela. They said we had up to 20,000 people in Venezuela. From the very beginning, we have been quite transparent, and their intelligence agencies, of course, they know that our presence in Venezuela is basically medical doctors, teachers, and people involved in cooperation projects. They know, they have all the tools and the resources to do that, but they pushed with that public campaign. During all those years, they have implemented 225 different decisions against Cuba. And when we talk about the blockade itself, we could go in details, but the aim has been basically to try to put Cuba on its knees, to surrender the Cuban people, trying to cut off any supply from oil to anything else. They have been after, I don't know how many banks, even UK banks, they have been affected. They have been under sanctions, and simply to surrender our country. Total, the last, of course, the rhythm of these actions was more severe during 2019 and 2020, when probably they felt that they went short of time and they have to produce some outcome, you know, and they kept pressing for a while. This government have been trying to reverse any improvement we had on the bilateral level on the previous administration, impacting not only people in Cuba, but people in the United States as well. When you cut travel and when you cut remittances, the Cuban community was affected at large. If they have affected even American companies that they have already some interest in Cuba, they were doing so under a specific license. That license was not extended, and then their business was affected. That's in general how they move forward and how they have severed bilateral ties.
Thank you very much. I mean, obviously, you know, we ourselves in this country have experienced the extraterritorial nature of the blockade ourselves. In fact, the bank accounts of Cuba Solidarity Campaign were all closed down by a British bank, the Cooperative Bank, under threats from the Office of Foreign Asset Control. So it's been a very tricky time for us, and clearly a very tricky time under the Trump administration, particularly in the last couple of years. So moving on to the current election, I mean, obviously it's not over finally right now, but we believe we're getting towards an end game. We very much hope so here. But what are your feelings now? Your feelings about the prospects for improvement in Cuba-US relations? Obviously, next year is not an election year, so that's a good thing in itself. But how optimistic are you about the next period, the next 4 years?
Well, first, any Cuban is optimistic. We are all optimistic by nature. When you see the way Cuba fought against Spain and looking for liberty and freedom, and the way our first Cuban fighters fought for independence, we have to be always optimistic, but we have to follow the events as well. As you said, technically, we don't have a president-elect yet, technically speaking, although media organizations, they have moved forward with a decision. You have still to wait until most officials, authorities in different states, they finalize the counting of votes and they certify that. And technically speaking, we have to wait until December, when something called Electoral College will provide the blessing from the new authorities. And then you have a transition period until January the 20th. Now, it's not a secret that around the new president, as part of his campaign, as part of his staff, you have people knowledgeable about that period that we mentioned before, people that have expertise on Cuban subjects. Now, we are optimistic and we are also consistent with the principle that our foreign policy is not tailored depending on who is elected. We do have one foreign policy with very profound roots in our history. And we have told the previous 12 presidents from the United States that we were always open to discuss our differences and to look for common grounds and to reach agreements. It's important to reiterate that Fidel Castro, the second country that Fidel Castro visited after the Cuban Revolution was United States. He went first to Venezuela, being thankful for the support we received from the Venezuelan people during his fights, and the Sierra Maestra and before. And then he came to the United States to explain to United States people and the United States authorities why the Cuban Revolution took place. He was welcomed warmly by the people of this country. He had the opportunity to talk to many officials, to talk with the media, and then explain it. And then since then, and even before, you can touch the sentiment of the Cuban Revolution in order to have a working relationship, at least with the American counterpart. That was our position then, is our position today. You have seen the public message from our president concerning what happened. We have the feeling that the American electorate voted for a change, a new path for the future. And we feel that in that new space, we can go back to a moment in which we were, again, looking for common ground and discussing our differences. Cuba has been ready for that for many years, was ready for that when the American side took the decision, and we remain as such.
Okay, thank you very much. And we, like you, are optimistic, we think, with a new president. We're certainly more optimistic than we were with Trump.
If I may, Rob, United States, as you know perfectly well, better than me probably, that is a very complex political system. And of course, the president decides on foreign policy. He has his State Department chief and officials. But when we talk about United States, you have to consider the federal government and you have to consider local governments and states. And we have had the chance, myself, during these 8 years, and my staff, to travel widely in the United States. We have visited, me personally, have visited almost half of all the states. I cannot tell you how many cities. I haven't found one elected officials, frankly speaking, anyone, any major organization, any large university, faculty members, any scientist, any people related to culture in the United States who doesn't support a different kind of relationship with Cuba. Then you can have, starting this coming January or in 4 years or in 8, you can have a continuation of the policy towards Cuba. And keep in mind, and you know very well, the core of the American policy, which is a state policy towards Cuba, is the embargo. What they call embargo and we call blockade. Well, that remains. We are talking about the new administration, but the embargo is there. How they will move facing that reality, we don't know yet. How leadership on both houses in Congress will move facing that limit and that hurdle, we don't know yet. And that continues to be there. But I can tell you, quite frankly, that in the same way in United Kingdom, the large majority of the population supports a friendly relationship with Cuba, the same happens here. Now, the new government or any next government will be transparent with that reality. We don't know yet, but that's a fact.
Thank you for that that clarification, and we totally see that really when we ourselves meet with people across the UK, for example, that there is an overwhelming desire for friendship, not just with Cuba, but across peoples, and particularly with Cuba from here, and I'm sure with the people from the United States. And I'm really pleased that we've got Navendu Mishra with us because Nav has been involved with Cuba for many years. I'll come back to the ambassador in a moment to talk a bit more about the election results, but that point led on to this very well, because we at this moment in time in the UK have good relations with Cuba, direct relations. We have no sanctions of any nature or in place between our two countries, and we really want to see that relationship developed. So it's important for us to look at the positives of a country like Britain in its relations with Cuba, because it can be a position that could be adopted by people within the United States. So I'm really pleased to ask Nav to say a few words. Nav has been a member of Parliament for Stockport since being elected at the last election in 2019. And previously, Nav was a shop floor trade unionist, an organiser for one of our biggest unions, Unison. And as a young trade union member, he was a delegate on one of the Cuba Solidarity Campaign brigades, May Day Brigades, to Cuba. So he's seen Cuba for himself. So I'd like to ask Nav to say a few words about Britain and Cuba. Nav.
Thank you, Rob, and special thanks to the Cuba Solidarity Campaign for organising this. It's wonderful to see Ambassador Cabañas and the new ambassador to London on this call, and I know that lots and lots of people are watching, and hope this will be available on YouTube later on. So I'm incredibly proud that my trade union Unite is affiliated to the Cuba Solidarity Campaign, and through Unite I had a wonderful opportunity in 2016, only 4 years ago, but seems like decades, during the current times we're in. I had the opportunity to go to Cuba for 2 weeks, and I saw Cuba for myself. Exchanges between people are very, very important, and the ambassadors made the point, Rob's made the point. Cultural exchange, economic exchange is vital in order to improve the understanding between each other, but also relationship. It's very disappointing, unfortunately, to see that the advances that were made under President Obama's leadership in US, a lot of them have been reversed under Trump. I'm hopeful that the current results that we are seeing in the US elections will see a significant improvement between the relationship between Cuba and the US administration. The blockade has been very damaging over the last since inception. The blockade has been extremely damaging to the Cuban people. It artificially makes prices higher. It makes it harder for Cuban government to get hold of essential medical supplies, food, and lots of other essential things. And what the Trump administration did over the last few years has caused real hardship, real suffering for the Cuban people. And as I said, I'm hopeful that under the new government in US, when they take over in a couple of months, things will be different. Anyway, a little bit more about the UK and relationship with Cuba. I'm pleased to say that in the UK we don't have that history with Cuba when it comes to the blockade. Although, of course, there's a lot more that could be done between the British government and Cuba, but also the UK government could do a lot more to challenge the US blockade towards the Cuban island and diplomatically and economically strengthen ties between the two countries. 2019 was a special year if you look at it through the lens of UK-Cuba relations. We saw Prince Charles visited Cuba. I saw some wonderful photographs of the royal couple at Havana car rally, I think it was. Hopefully one day I'll get the opportunity to visit that. But it was a big moment between the relationship between London and Havana. We had the royal couple that visited, and that visit in 2019 was followed by the visit of the Cuban president, the new Cuban president, Miguel Diaz-Canel, in 2018. I had the wonderful opportunity to meet him, and I know the former leader of the Labour Party, Jeremy Corbyn, and several other MPs and trade union leaders from the British trade union movement were at that meeting as well. When the previous Cuban ambassador was in her position, and the all-party parliamentary group in Cuba, which my friend and comrade Paula Barker, she's the vice chair of, they hosted the president in Parliament. Paula and myself weren't in Parliament at the time; we were only elected just under a year ago. So it was a different world. But Graham Morris, I'd like to pay tribute to Graham Morris, Member of Parliament for Easington, Labour MP from the Northeast, who's done a lot of work over the years to build that group up and get people from cross-party MPs involved and to discuss these important issues and building on cooperation between the UK and Cuba. I'm also pleased to hear about the joint project between the two countries when it comes to the UK and Cuba. And in October, just a few weeks ago, the British ambassador to Cuba, Dr. Anthony Stokes, said that cooperation between countries is essential in responding to the challenges posed by COVID-19. The British Embassy has announced funds from the British Foreign Office runs an international program, and they've announced funds from this program to support Cuba in response to the COVID-19 pandemic at home, and also investing into research and treatments for COVID-19. Cuba has a well-established biomedical research sector. There are lots and lots of people from North America, Latin America that visit Cuba for treatments, and I know Paula's going to talk a bit more about the medical system in Cuba, but I think most people will be aware that if you look at the data for Cuba, the metrics are phenomenal. You know, some of the metrics, if you compare to USA, which you could argue is one of the richest economies in the world, Cuba beats US when it comes to some of the medical support that's available to Cuban people at no cost, provided by the state. A bit more about the UK-Cuba relations. There are some really excellent examples recently this year between London and Havana cooperating, and the University College London, the famous institution, and the Cuban Center for Biotechnology. They have set up a joint project to work together against COVID-19 and to deliver improvements. Recently, in August, a couple of months ago, Cuba's BioCuba Pharma, the company, and British company SG Innovations, they announced the creation of a new company called Biopharma Innovations, which will look into producing and selling innovative medicines in Europe. So that's a wonderful thing. More recently as well, the British Embassy in Havana worked with Cuba to support posting of medical brigades to British territories overseas that were difficult to get to in July. And they put it on the record that they appreciated Cuba's support, medical support to fight COVID. And I'd like to take this opportunity to thank Cuban government for being the only country that came forward to accept the British cruise ship MS Braemar, which had a massive COVID outbreak. And I was actually in the House of Commons chamber when the Foreign Secretary, Dominic Raab, made the announcement and thanked the Cuban government in the House for the support they offered. There weren't many countries willing to accept that cruise ship, and there were lots of British nationals on that ship. And for a country like Cuba, which has suffered so much under the blockade over the decades, to come forward and say, actually, we'll step in and we'll support these people, regardless of what nationality they are. There's COVID outbreak. We have an excellent medical system. And even though, let's be honest, Cuba is not one of the most affluent countries, it stepped up to support people. And I'm glad to see that the Foreign Secretary, even though Paula and I and many people on this call will have our political differences with the current UK government, I'm glad that the government officially thanked, the UK government officially thanked the Cuban government. And the bottom line was, there are people that need help on that cruise ship, and we'll step up and support them. And that's a wonderful example of what the Cubans have done recently for the UK. And I think just on that note, there's lots more that can be done to build on this. And both countries, the UK and Cuba, can learn a lot from each other. And unfortunately, during the COVID-19 crisis, it has shown us that international cooperation is the only way to beat this deadly virus. And Cuba shows us a good example of how that can be done. And once again, I'm grateful to Cuba, Havana, stepping up to support the people on that cruise ship. I'd like to add my thanks also to the medical brigades that have been running, that Cuba has been sending to Africa, Asia, some of the poorest places in the world, not financial gain, but out of international solidarity. And I myself, as a member of Parliament, I'm eligible to nominate groups or individuals for the Nobel Peace Prize, and I've got the process rolling, and I'll be making a nomination. I think Paula and several other Labour MPs will also be making a nomination, and I hope that the campaign is successful. If you haven't signed the open letter, the petition, please do on Cuba Solidarity's website. And I think on the final note I'd like to end on is that it's really important to understand that the US blockade has an impact not only against ordinary people in Cuba, but also people in the UK. Here in Britain, there are UK companies, UK businesses that have been actively stopped from trading with Cuban organizations. British banks have been fined under the US blockade legislation. And I know that the Cuba Solidarity Campaign had its own bank account suspended and eventually closed down a few years ago. And tragically, I think it was about 2 years ago, there was a Cuban national who wanted to study at the Open University in the UK, and they were denied access to education. And I think that's shameful. People should not be discriminated against based on their nationality, ethnicity, their gender, or their background. And I'm glad that the British trade union movement came forward with the British Cuba Solidarity Campaign, and they were able to get that decision reversed. It is absolutely unacceptable that in a country like the UK, people are denied education or access to a course based on their nationality. Is unacceptable. And that was a great example. I think I was with Rob in Manchester when he had the news come through that Open University have reversed their decision. So I remember that distinctly. But I could go on for a long time, and I'm not going to. There are more interesting people you want to hear from. So I just want to end on the note once again of thanking both ambassadors, thanking the campaign. And I want to give both ambassadors the assurance that in the UK we'll continue to campaign for improved relations between the UK and Cuba, and pressure the US through United Nations to end the blockade of Cuba, regardless of whoever is in the White House. So thank you.
Thank you, Nav. That was brilliant. And of course, one of the aims of the Cuba Solidarity Campaign, the parliamentary group, trade unions and so on, is to help develop good relations and better relations between our two countries, because it gives an example of what is possible in the world. So thank you, Nav, and thank you for your work. You are a wonderful member of Parliament and a wonderful support for progressive causes and for the work of the campaign. On that point, I know over 300 people are watching us on YouTube and Zoom. That's really, really wonderful. And many, many more will see the recordings after. We, as an organisation, are usually out and about at conferences, in meetings, up and down the country. And obviously, it's a tricky time for us. It's a tricky time for everybody. But I do have to ask people for their support. I know many of you will already be members of the campaign, but if you're not, please join. If you can give any donations, small donations towards the work of the campaign, it would be very, very much appreciated. And I think we are posting up messages and links so that you can join and you can donate if you wanted to towards the work of the Cuba Solidarity Campaign. Thank you. So returning back to the ambassador in Washington, the Cuban-American vote has been talked a lot about over many, many years, and particularly every election cycle, being as it is very much in Florida, where most of the Cuban-American community live. Could you perhaps talk a little bit about that, and perhaps talk a bit about how the Cuban-American vote affects the relations between the two countries, why it's so important during the election cycle, and how people such as Marco Rubio, Senator Marco Rubio, play a role in that diaspora and that development of that kind of body in Florida? How influential is it?
Well, thank you, Rob. First, let me also I joined you thanking the Member of Parliament for that presentation, and also for the continuous show of solidarity towards Cuba. It's meaningful and it's very important for us. Now, to respond to your question, well, first, the so-called Cuban vote is a fiction, Rob. It doesn't exist. I mean, you have a community. We have a large community in the United States, but probably the British community in the United States is larger than Cuban community. And you never hear people talking about the British vote in American elections. You have not only 34 million people with British ancestry, but you have almost 700,000 British citizens living in the United States, and no one take them as a whole, as a monolithic block, deciding elections. The first idea to respond to you will be the so-called Cuban vote is a fiction. It doesn't move in one way or the other in a monolithic way. It doesn't support one candidate or the other in a monolithic way. And all data regarding this is not precise. Depends on polling, depends on academic studies. Then you don't have, as part of the Census Bureau, a clear image about the vote. And the Cuban vote was a creation, and we started to hear about that mainly in the early 80s. Before that, you had already a large presence of Cuban Americans in the United States, and never ever you heard about people talking about a Cuban vote. What happened in the early 80s, it was an agreement between at the time, the Republican Party and some, basically one organization in Florida. And it was like a trade, you know. You talk about the Cuban vote and you pass legislation supporting regime change programs. Remember Radio and TV Martí at the time. And then we gather for you and we do some campaign here in this area, basically southern Florida. And then we add some votes for you once you have a midterm election or presidential election. The second largest community, a Cuban-American community in the United States, is based on the area of New Jersey and New York. You never ever hear people talking about the so-called Cuban vote in that area, although we are talking about thousands and thousands of Cubans living in that region. And even if we were, from the academic point of view, we were trying to define the Cuban-American vote in Florida, well, first is the larger communities in Miami-Dade, the Miami-Dade counties is consistently won by Democrats. They don't change the balance there. And if you go to Hialeah, which is one of the areas in Miami where you have the largest percent of Cubans, well, how you would interpret that 55, 56%, depending on the polls, they supported Republicans, and they supported in a larger percent a socialist request, which is to raise the minimum salary. How you consider both? I mean, they are moving one way to support the Republican agenda, and then in the same way to support a more liberal agenda. But even if we were to consider the so-called Cuban-American vote meaningful in South Florida, then how you respond the question, how you answer the question that they supported in that percentage Republican Party for these presidential elections, but at the same time, they were not able to defeat the Democratic candidate to become mayor of Miami-Dade, who was a lady, a Democrat, a member of the Democratic Party, a lady, and someone that did her campaign talking about transparency. I can tell you transparency is a bad word in Miami. It's not a very transparent place, you know, in many regards. Then just to give you as an example that it's a fiction, it's not monolithic, and every 2 years, the Florida International University, they have a poll on Cuban Americans, largely on Cuban Americans living in Florida. And it's consistent since 1991, when you follow the outcome of the poll, it's consistent that more and more Cubans living in the United States, they support at least something that they call the family agenda, which is communication, remittances, travel, things like that. They want to support their family in Cuba. I have to tell you that remittances don't move just in one way, because for some families, that money that goes as a way of small investments, I would say, in some private businesses, and American authorities, they have registered the money returning to the United States. And then you have money going on both sides. And Cubans support that largely. I have to tell you that second generation Cubans and third generation Cubans, business people, university professors, scientists, they are eager to go and to develop bilateral projects with Cuba. Then basically it's a nonsense, and most of the Cuban-American, the so-called Cuban-American vote is now mainly American vote. I mean, people who were born in the United States, they are American citizens, they speak English fluently and not Spanish at all, and it's difficult to have all those characteristics part of the same bowl, you know?
Thank you, Ambassador. I mean, it is obviously a very complicated situation, but it's almost, we see it a bit like a family relationship between the Cubans in Cuba and the Cubans in America, and there are lots of complications in all our families, as we all know. So it's really not a straightforward, this lot say this and this lot say that. It's much more complicated than that. So thank you very much for your explanation. Moving on to something that obviously is very worrying for everybody, the situation with COVID-19, the coronavirus. You live in the United States, you've seen the response in the United States to the virus, and you've seen how the US government under Trump have responded, which has been quite alarming for many of us here. You've also seen how the people of Cuba have responded, and the health service and the Cubans on the island have responded to COVID-19. Could you comment a little bit about those responses and perhaps the differences that you've witnessed in the United States and in Cuba, and if it tells us anything about the countries, about the health service, about the thought processes going through the leaderships in those countries and the response of the people?
Sure. Well, as we speak here, United States passed the mark of 10 million cases of COVID, and you have followed the figures during the last days. They have record after record, 126,000 cases, things like that. Where a question mark about the health system in the United States, of course, they come before this pandemic. For many years, we have been supporting bilateral exchange on the field, and we have like kind of discovered, the many differences we have on both systems. I mean, our system is not perfect at all, but we wonder things that could be implemented quite easily with very low income. And it's basically about conducting a dialogue among experts, and it's about, in some cases, common sense and the way they organize, where we have perceived the differences. First, in Cuba, we do have a national system. In the United States, you have, no matter what, if it is public or private, but you have, I don't know how many systems of health, public health, that none of them is complete. I mean, they are like fractions, Even among services, I mean, you can visit the hospital because you have a headache, and the expert will not ask you about the stomach. I mean, they are like two different fields, and they are not interconnected. Well, in Cuba, we don't understand. It's not in our philosophy to understand that. And things like, in Cuba, we have basically a preventive system. I mean, here you have to, in order to visit a hospital or a clinic, you have to be sick. Well, in Cuba, you have not only a family doctor, but you have health authorities knocking your door, asking questions, advising, teaching. And our children are educated since they are very young on several principles. The safe way to eat, safe way to do sports. Then just that you have to, you get hospital services simply because you are sick. We don't understand that. And by doing so, as I said before, we save a lot of money. I mean, because in the way they handle public health in the United States, you deal in many cases with something that a situation you cannot fix anymore. I mean, a critical patient suffering from any specific disease. Now, on top of that, in Cuba, you have national campaigns of vaccination against, I don't know, at this moment, against how many diseases, different diseases. If you talk to a Cuban doctor, he or she will tell you that they knew about one particular disease on the books, and then when they travel abroad, because in Cuba, it's a disease that has disappeared for I don't know how many years. Then we do have different layers that all of them are interconnected, and the way they share information and they register the information as well. You would remember that 4 years ago, we were recognized as the first country that detained the contagious syphilis and AIDS from mother to child. I mean, PAHO certified that. And when you talk to experts from PAHO, they will tell you, you know what? Probably Cubans, they don't have computers in all hospitals, in all clinics. But what I can tell you for sure is that the figure they have in the last municipality in the eastern side of the country is the same number that they have at the National Ministry of Public Health. Then it's a very coherent system that works, at least for us, for Cubans, it works. And not to say that everything goes through the Constitution saying public health is a human right. I mean, unless you follow that, unless you believe blindly on that, it's impossible then to build a system, a public health system that matches your expectation. It's different in the United States. We have done what we can in order to share with authorities and experts and local elected officials what is available. As I said before, among the 22 MOUs, we had 2 on health in order to exchange our way of thinking, our expertise. We have been eager from the very beginning to share our expertise on COVID. It hasn't been possible to organize that officially, but we have supported and we have had several webinars among experts in the United States and Cuba sharing what is available. In Cuba, we do have one protocol to fight COVID. We have 10 or 11. Here in the States, regrettably, you see people in the media, not a private conversation, but in the media saying, I don't know what to do. Early this year, in March or April, in many hospitals, they didn't have even one protocol to follow. They didn't know how to react to that. And we have stated several times, our authorities in Havana, they have done so, that what is available in the United States and what is available in Cuba, being knowledge, technology, whatever, research, then we could do many things for our region, for the world. And you had the expertise on Ebola. United States and Cuba were the only two countries that sent people, real people, physically, to fight Ebola in Africa. Other countries, they send resources, they send equipment, but the only two countries that sent real people to fight Ebola in Africa were Cuba and United States, and we were very successful. Under this administration, on the current administration, we were able to develop a cooperation program in Chicago, Illinois, with the support of the city, the state of Illinois, the University of Illinois, and the Kellogg Foundation, to try to reduce the impact of cancer on the young African population and to reduce the mother mortality rate. 5 months, 4 Cuban experts, and simply what they simply indicated or shared with local officials and experts in that region is the way they handle information, the way they organize the system. They didn't go with a shipment of new technology or any new vaccines or anything like that. Simply how to organize the system and how to invest first in prevention. And the same year, almost 2018, we signed the first joint venture between Cuba and the United States. It's alive, it's there, between the Roswell Park Cancer Center in New York and the Cuban Center for Molecular Immunology, to introduce a lung cancer vaccine called Simavax in the United States, to conduct clinical trials and to use it in different kind of cancers that is affecting this population. That cooperation is moving forward in a very positive way. We have other companies looking for Cuban products to be taken to the United States, like Wavertree, to fight the amputations on the diabetic foot. We have stopped in Cuba 73% of amputations. In the United States, you have 80,000 amputations related to diabetes a year. Then that could have an impact on this country. And like that, we can go on and on and on in referring other biotechnology products in Cuba. And simply to finalize on this, we have had the chance to communicate experts in the States and Cuba back and forth on specific cases of COVID. And I can tell you that several people in the United States, among them Cuban-Americans, they saved their lives because they had the proper advice from Cuban doctors, talking with the doctors that were taking care of them here in the United States. That simply tells you that through the dialogue, through sharing expertise and knowledge, many lives can be saved. No doubts about that.
Thank you very much, Ambassador, for your extensive response. Obviously, you were very polite, I think, in the fact that you didn't mention the massive private sector involvement in healthcare in the United States, which I think is one of the huge differences between the two countries. There's not so much money to be made out of preventative medicine as perhaps there is out.
We have to be polite. I was polite by saying that in Cuba it's a human right. In other places like the United States, it's a product.
Exactly.
And you can buy it if you have the resources. If not, it's a different
absolutely.
world.
Briefly, we have watched in admiration, and I know Paula will speak about it in a moment, about the Cuban medical brigades traveling around the world to, I think, about 40 countries now to help countries that have asked for assistance. But also that has gone on for 60 years. It's not something that has just taken place in the last year. Cuban internationalism has gone on for many, many years. Yet the Trump administration has been waging a war, a propaganda war, but an actual war against these medical brigades, and have really been applying pressure on third countries to stop such medical cooperation. I know there are some senators who are trying to put through some new laws to actually block third countries from working in cooperation with Cuba. Could you just briefly say something about that, about your feelings towards that attack upon the Cuban medics at this time, and how that impacts on relations between the United States and Cuba?
Well, it's a nonsense by all terms, you know. There is no argument. I mean, to call Cuban doctors going all over the world slaves, I mean, you have to be really mad. That supports no rationality. You know? It's a political argument. The scientific community in the United States and the Cuban scientific community, they have had ties for 150 years, which means that they know each other very, very well. It's an argument that no scientists in the United States support. I mean, people laugh, you know, about the one they hear about that. But as you said, the State Department and other officials, they kept going ahead with that campaign. Well, they have had some, they have been defeated, you know, they have had some failures. We have witnessed how from large countries with a lot of resources to small countries, they have responded by saying, you know what, the Cubans are our friends, our neighbors in many cases, they came to us. United States mentioned the funds, our income, Cuban income after those projects. Well, our public health authorities, they have mentioned several times, in many cases, we covered a large percentage of the expenses. In other cases, we do have compensation, but the impact of those projects and the presence of Cuban medical brigades in many, many countries is, I mean, is paramount. You cannot measure by money, any amount of money, the impact of those projects. Remember that in countries like Haiti, when they had the 2010 earthquake, and then you have not massive, but you have many people coming in, they arrive and they ask Cuban doctors, well, when did you arrive? Oh, we arrived 10 years before, because we were there before. We were there when most people went to take pictures and selfies, but not cooperating that much with Haiti, and we remained there. And in Haiti, we have currently more than 400 experts. Tell me the consequences if we withdraw that brigade from Haiti. And as you said, we have supported specifically on COVID more than 40 countries. Not only third world countries, we had the brigades in Spain and Italy, and in other countries that they don't consider themselves third world countries. But you have to add to that amount to the 59 medical brigades we have in 59 other countries dealing with other diseases. And you have to add to that, and I'm sorry when I responded about the differences between the health system in the States and the health system in Cuba, I didn't mention the Cuban School of Medicine, which is one of those pillars that support our system. I'm saying that because we not only send experts to foreign countries, but we also welcome human capacity in Cuba, and we educate that human capacity. But in other countries, we help to create the faculties of medicine or universities devoted to medicine. We have had in this world, my friends, several countries that until the 21st century, they never ever had one school of medicine. namely in Africa, for instance. But in that particular case, and the project called ILAM, the so-called Latin American School of Medicine, that is not Latin American for many years. We have hosted students from more than 100 countries. We have graduated 30,000 plus students, including people from the United States. I mean, we have like 200 physicians in the United States working all over the country that graduated in Cuba, never ever dreamed with studying medicine because their family couldn't afford. We have almost 100 these days in Cuba, by the way, for free. When they talk that we do everything regarding income and funding, those young kids, they have come to Cuba because the American people have shown solidarity towards Cuba. We have shown solidarity to the American people as well. And all of them, they have come for free. Now they are good physicians. They are welcome in their communities. But again, is again going back to our principles, the way we see that service, how that service should be provided. We implement that in Cuba, and as long as we can support other countries, more than eager and pleased to do that.
Well, Ambassador, the Cuban health miracle is truly a miracle. We could talk at length about Operation Milagro, the Chernobyl children, ELAM, and so on. We were very fortunate to have some doctors from ELAM speaking at a previous meeting, talking about their training, but also talking about their work in the United States.
And if you allow me, because we can be talking, as you said, for hours, but the United States officials, a few actually, they have pushed for that cooperation to end. Every time we have a discussion on that in Washington, I ask them, okay, let's say that we withdraw immediately for all these 59 countries. Are you going to replace us? How many people you're capable to send and to stay there for that many years? Are you really going to replace us? Do you have that capacity? I mean, do you have the leader of the so-called free world? Do you have the capacity to do that?
I'm not sure that's their motivation, Ambassador, but certainly we can speculate as to why they are pressing Cuba on these questions in third countries. But I want to take this opportunity to ask our other member of Parliament, Paula Barker, who is from Wavertree in Merseyside. I'll get that right this time. Sorry about that. But I wanted to ask Paula, because Paula is one of those members of Parliament who has supported the campaign for the Nobel Peace Prize to be given to the Cuban International Brigades. She herself was also a trade union official for Unison, representing public sector and health workers before she became a member of Parliament. So, Paula, if you wanted to say a few words, we're very, very pleased we are to have you with us this evening.
Thanks, Rob, and it's an absolute pleasure to be with you this evening and to continue the work that I've done with Cuba Solidarity over many years now. And it's an absolute privilege to be on this evening with Ambassador Cabañas and also Her Excellency Bárbara Montalvo Alvarez. And before Bárbara became the ambassador to the UK, I had very, very strong links with Teresita Vicente, who's now gone back to Cuba. So I look forward to our continued work going forward, and it's a massive privilege to me to serve as the vice chair for the all-party parliamentary group for Cuba as well. So as Nav said earlier in his contribution, it's really important for people on the call this evening to sign the petition for the Nobel Peace Prize for the Cuba's medical brigades. And I'm absolutely delighted and proud to have been able to nominate Cuba's Henry Reeve International Medical Brigade for the Nobel Peace Prize in 2021. For their contribution to provide humanitarian and medical assistance to the populations of countries which have been hit by natural disasters and, of course, the epidemic of COVID-19. And whilst we are in unprecedented times and suffering through this pandemic, It really has been truly inspirational to watch how Cuba has assisted other countries in their fight against COVID-19. More than 3,700 Cuban doctors, nurses and technicians have responded to overseas requests to help the fight against COVID-19 by volunteering as part of the island's international medical brigades. And as we've already heard, they've travelled to nearly 40 countries, including Jamaica, Italy, Angola and Azerbaijan. And as Ambassador Cabañas has already said, it's not the first time that Cuban medics have answered the international call to respond to a health emergency. In 2014, during the Ebola epidemic, Cuban medics also treated more than 2,000 patients. And for anyone who doesn't know what the key principles of the Henry Reeve Brigade are, quite simply, it's health, peace, humanitarianism and solidarity. And since its formation in 2005, the Cuban health workers have provided relief in emergencies regardless of politics or borders, which is a true example of internationalism. And as a former trade union official and as a Labour politician, I'm also an internationalist. And when I was active in my Unison, I was privileged to hear one of these health workers, Dr. Carlos Dupuy, speak to our national conference in 2007. Dr. Dupuy, for those of you who don't know, led the nearly 2,500 strong Cuban emergency medical team, which treated 1.7 million people affected by the Pakistan earthquake in 2005. Absolutely incredible show of solidarity and internationalism. And over the past 15 years, 10,000 members of the Henry Reeve International Brigade have treated over 4 million people, saved 90,000 lives during natural disasters and health emergencies in 45 countries. And I believe that their inspirational internationalism deserves to be recognised. And Cuba's current contribution to the global fight against COVID-19 comes, as we've already heard, as the country itself is struggling under the economic hardships caused not only by the pandemic, but also in the face of the economic blockade against the island, which was obviously made even worse by the Trump administration. And I sincerely hope that the President-elect Biden, really tries to take away what the Trump administration has done and build some solid footing going forward. So as I've already said, the brigades have made an unparalleled contribution to global health. And I believe that the Nobel Peace Prize would bring to their work basically a catalyst which is needed to widen this collaboration and provide a template for future global cooperation in healthcare. And it goes without saying that there is so much that we can learn about medical cooperation and medical training from Cuba. And when you think that we have shortages in nurses and GPs in this country, it's incredible to see that more than 30,000 medical students from more than 100 countries have been trained by Cuba in the last 20 years, and all the time struggling under the illegal blockade. Cuba is truly a beacon of hope, and the example that they set and the hope that they bring to communities across the globe makes them a real worthy recipient of the Nobel Peace Prize. So I'm delighted to have joined many other politicians and academics around the world to have made the nomination. And I sincerely hope that when we see the results next year, that the brigade is the worthy recipient of this prize. And I'll end there, Rob, because I know that we have people wanting to ask questions of the ambassador. But thank you very much for the work that you continue to do at CSC, and Viva Cuba.
Thank you, Paula. Thanks so much for that contribution. It was wonderful. Paula is one of the members of Parliament, along with Nav and Graham Morris, also some Scottish members of Parliament, Neil Finlay and Elaine Smith, and some academics who have already completed formal nominations for the Nobel Peace Prize 2021. And we're working very hard to get more nominations and to build the campaign. We have over 6,000 messages of support on the petition now. So if you haven't signed it, please do so. The links are online. We're just going to briefly hear now straight away from a lovely message we received just in the last couple of days from a wonderful actress, one of our preeminent actresses, Maxine Peake, about the campaign for the Nobel Peace Prize. So we're going to play that now. It's just a 1 minute long.
This health pandemic has been such a challenging and difficult time for so many people. So for me, there's been a glimmer of hope to hear about the wonderful Cuban doctors and nurses helping so many people in so many various countries across the globe. They travel thousands of miles from a relatively poor Caribbean island to help those in need. Now, I hope that millions of people will get the opportunity to hear of this amazing story of human solidarity across borders. This form of international sharing and cooperation is surely the only way we will be able to emerge from this current crisis. Now, I hope the Cuban medics are awarded the Nobel Peace Prize, a truly fitting recognition for all the wonderful work they do. Thank you.
That's brilliant. And thank you, Maxine Peake, if you're watching. Really lovely to hear from you. We have a whole host of messages, and we're very much trying to reach out beyond parliaments, academics, social movements, celebrities, VIPs. So if anyone knows any, do get in touch. We'd love to hear from some more actors and artists and so forth. Well, as Paula said, we are running out of time, and we do want to try to get a couple of questions in at the end. But I just want to ask the ambassador a couple more questions, if I can. Ambassador, it's impossible, of course, to talk about Cuba and the United States and that relationship without talking about the blockade. The blockade is the key factor in all of this, as we know. And Cuba has just published its annual report to the United Nations, which you do every year, talking very in tremendous detail about the impact of the blockade on every sector of Cuban society. Of course, the UN vote has been delayed this year and will take place in the spring next year because of COVID-19. But could you tell us a bit about that report, about the main findings, and very briefly about some of the key components of the blockade and how they impact on the daily lives of the Cuban people?
Well, thank you, Rob. And again, thank you, Mrs. Baker, for that presentation. We know it's heartfelt. Thank you very much. In regards to the report, our Minister of Foreign Affairs, Bruno Rodriguez, presented this year's report publicly October 22nd. Had a conversation with the media, going through the key elements of the report this year. I will certainly suggest your audience to go online on the report. Open. A report is a book, you know, with a lot of details about the subject. As you said, the blockade is the core subject of the U.S. state policy towards Cuba. You have nothing like that in human history. I mean, for 60 years, and taking into consideration how many elements, and it's a policy aimed to surrender one country. You have had wars for 5 years. You have had large wars for 10 years. But this has been an economic and political war against Cuba for 60 years, almost 60 years now. And every time you move through the history, you have more elements that are added. You have the first presidential action on the blockade was back in 1962. But all along the years, you have followed not only new legislation, but the executive actions to complement the blockade. Just to give you a few, to highlight a few details from this report this year, is the first time we calculate on money, on funds, the impact in American dollars every year. Well, this is the first time that amount goes over $5 billion a year. It has been the impact. This is a calculation that goes from March the previous year until March this year. Then it doesn't consider the impact under COVID. And that takes us to tell you that if COVID was always a crime, was looking for an outcome in Cuba that will be genocidal, well, this year is worse because they kept doing the same and implemented the same policy under a pandemic like COVID. Is the first time that goes over the mark of $5 billion. Is if we talk about in terms of current prices, the total amount all along these years is $144 billion, more than that, actually $144.5 billion. But if we consider the impact with the depreciation of the dollar in comparison to gold, is 1 trillion plus the impact all these successive years. On the report this year, the minister highlight, I said, responding to the previous questions, that we are talking about 225 actions implemented on the last 4 years, 121 in the last 2, and in the report this year, the minister summarized several of those actions in order to cut off the financial system from Cuba. I mean, to make financial transaction impossible. It has an impact on our imports on food. It has an impact on our imports of fuel. It has gone against vessels bringing commodities to Cuba, to stop flights from the United States and to reduce considerably those flights, to stop remittances coming to Cuba, things like that. Definitely, I invite your because we could go. I have here with me several details on the report, but it has a major impact on Cuba. Of course, our life would have been different without the blockade, and not only the blockade, other actions that are taken specifically against Cuba. It has an impact in the United States as well, and it has an impact on third countries. Your member of parliament referred to that before. I couldn't do it better than him. How it impacts in United Kingdom, Europe, several other countries.
Thank you, Ambassador. Just very briefly, we've had an interesting, well, it's a straightforward question really from Patricia in York, which fits in here. I mean, over many years now, the vote against the blockade at the United Nations has been 187, 189, 190, to just 1, 2, or last year, I think it was 3 countries voting to maintain the blockade, the United States, Israel, and I think Colombia last year. She just asks, why, if the whole world is against the blockade, why does it still continue?
Because it makes no sense. I mean, you can add to those votes, you could add 330-something million Americans that don't support. The Americans will tell you, they will talk to you about democracy and democracy in action and whatever. Well, allegedly, people elected have to represent the people who elect them. Most of the senators in the United States, if not all, and most of the members of the House are elected by people that don't support the blockade against Cuba. Then if transparency and democracy works, they should support a different kind of policy. But the aim is, again, to keep sovereignty out of the Cuban people, to surrender a model that is different from them, to, I mean, our sin is to talk by ourselves, to consider ourselves equal to anyone else, not only the United States, but to small countries in the Caribbean. We are equals. That's the Cuban sin. To say no when Washington is saying yes, that's our sin. Then for many years, different governments in the United States, they have tried to change that path. They have wanted basically people to surrender to their command in the Caribbean and Latin America. And our sin is our example. I mean, the way we have managed our local businesses and our foreign policy in Cuba. That's the aim. That's continue to be the aim. It's in place. It's enforced. And let's see future authorities in the United States and the future Congress, how they will manage that. I have to tell you that the blockade is an embarrassment for the United States all over the place. Even close allies of the United States, they come to them and they tell them, I mean, it makes no sense. It's a fiasco, too expensive, no prestige for the United States, and an argument that even your campaign of solidarity mentioned when we were trying to free the Cuban Five, it has been for a long time. I mean, probably the argument that most people understood in the United States about the Cuban Five is when we said it has been too much time for no reason. Well, if this is the argument that the American people and people all over the world could understand better, it has been too long, too much time trying to oppress and trying to push people in Cuba simply for deciding about the future freely.
Thank you for a brilliant response. Thank you very much. I'd like to just quickly say we have had over 300 people watching, people from South Africa, many people from the United States, but also from Cuba, from Ireland and across Europe. So welcome to everybody tonight. Just briefly, another appeal. If you're not a member of the Cuba Solidarity Campaign, please join with us. It is really the best way to help the people of Cuba in their campaign for sovereignty and against the blockade. And there are links to join the campaign coming up on your sites. We produce a magazine 4 times a year, a fabulous magazine. We get people together, host events like this, but you'd also receive a free Che Guevara bag and a badge and all sorts of good things. So do join Cuba Solidarity if you can. That would be a wonderful way of helping to fight against the blockade. I'd like to just, we are running very late and we are going to finish in exactly 10 minutes at 10 past 8 because it's not fair to keep everybody here. I know people are enjoying this meeting very much. The feedback has been amazing. Very briefly, I'd like to ask Her Excellency Bárbara Montalvo Alvarez if she would like to say a few brief words to the meeting. Bárbara.
Thank you, Rob. What can I say? First, greetings to friends of the Cuban Solidarity Campaign, Paula, Navendu, Ambassador Cabañas. I would like once more again to thank the organizers for this opportunity. I followed with special attention all panelists, and personally, I think it has been an exceptional meeting, a very important and helpful exchange. All those who participate in these events recognize the effective and committed work behind each of them. The campaign does countless efforts in the UK and endeavors to find valuable speakers to contribute to a better knowledge and understanding of the Cuban reality. For time now, the CSE has been running a successful to support and encourage the nomination of the Henry Reeve Medical Brigade for Nobel Peace Prize. I will not miss any opportunity to express our profound gratitude, especially to some members of the campaign who made the nomination. A big thank you to MPs Paula and Nav, to my colleague and friend Ambassador Cabañas. You know, it is a privilege to have him in any panel on foreign policy, but especially if it is on the United States. Thank you once more again to CEC.
Thank you, Ambassador. It's a pleasure to see you again and to have you in the meeting this evening. We only have time for a couple of questions to the Ambassador before we finish. We have a question from Lauren in London, Ambassador Cabañas. She's concerned regarding President Trump, as we all are, and the fact that he is still president until January the 20th. Are you worried at all about the fact that he may introduce even worse sanctions or measures against Cuba under pressure from right-wing Congress people, and to leave a mark, if you like, in his presidency before he goes in January? That's one question to you.
Well, we are, I have to say, we are probably concerned, not worried. We have been through more difficult things before, and we know how to deal with them. Now, he has promised to be pushing until the end. During the last days, we have seen like a move in regards to Iran. I mean, they keep talking about the Iran, Iran as a country and the government, the many measures they think that they will implement. And we will be following the situation. Of course, we will observe until the last minute of this administration. We have no doubt about their willingness to harm the bilateral relationship. And at this moment, it's up to the American people and the American authorities to prevent that from happening. Cuba, I can tell you, we will always have responses to any actions that it is taken by United States. But I personally believe, personally speaking, that they need to take some time to look inwards and to try to solve the many problems they have domestically in the United States.
Thank you very much. We have had lots of questions, and I do promise everyone who's asked questions, we will respond to all of you with your specific questions that have come up. Unfortunately, we're not able to ask all of them here, but I think there is one question which is a theme of quite a few people, is how can we help the people of Cuba, and what can people around the world do to help the people of Cuba against the blockade and at this time of coronavirus? That's the final question to you, Jose.
Well, I will simply replicate what Ambassador Montalvo said in terms of how thankful we are for your campaign, your support. As you said, we have many people from the United States following the webinar, and I will send a regard now and to thank them for the way that they have supported this cause. We have been asking United States, well, if the blockade is lifted, the solidarity groups will disappear or things like that. And I said, I don't think that will never ever happen, because solidarity movement and the solidarity groups, what you do, you build bridges. People to people bridges. You tell your truth. If you ask me about what to do, as simple as tell people what you frankly believe about Cuba. Tell people about what you have witnessed when you visit. I can tell you, this administration has been, and the Cuban enemies in the United States, they have been so focused on travel, because they know that every person that goes to Cuba see by themselves what is Cuba all about, and then they return and talk to the families, to the relatives, to the friends. 90% of them will tell you Cuba is not what I was told it was. And only by saying that, they go against a wall of misinformation that we have suffered and has been dividing our countries for so many years. Roughly, we had since late 2014 until late 2018, early 2019, 5.5 million people, 5.5 million, traveling back and forth from the United States to Cuba, and again, back and forth, 5.5. Cuban-Americans, Americans. They have a different view about Cuba. You can publish, I don't know how many editorials, you can publish, I don't know how many statements, and they know for Cuba what it's all about. We are not the enemies trying to invade or to impose anything on the United States. They know for sure. That's why they are so concerned about travel to Cuba. It has nothing to do with our income, has nothing to do to money flowing to government, nothing to do. It has to do with the truth. And the solidarity groups, they have been all the times sharing what they know and what they learn about Cuba. And I joined Ambassador Montalvo to thank you from the bottom of our heart for your word that is for free. I mean, no one is paying you for doing what you do. When we have members like you in Parliament, it's very, very meaningful. And we thank you on behalf of our people, what you do now in terms of the Henry Grief Brigade, because not that many people know about what it means for them to leave the family behind, to go to places where you have chances. You never know if because of a disease or any accident you can return or not. And simply by calling the attention of the committee this year and telling them that you believe that they deserve such a recognition, that is something that we are very, very grateful for that. Thank you again.
Well, Ambassador, both ambassadors, I can only say from myself, but I'm sure from everyone at Cuba Solidarity Campaign, members of Parliament, trade unionists here, and all of our members and all of our friends who are with us tonight, that it really is our honor and our privilege in many ways to work with Cuba and to work in solidarity with yourselves and the people of Cuba. And at times of international crisis, as we are seeing now with this world health crisis, it is, as someone mentioned, a real beacon to see Cuba standing proud, showing the world that there is a better way to help people across borders, giving what you can give, rather than hanging on to what you have got and stopping and blocking people from sharing and cooperating. Because as I think Maxine Peake said in her video, the only way we will emerge from such a crisis is to cooperate and to share. And that is definitely the best way forward. I'd like to thank all of you who have attended the meeting tonight, who've been with us this evening. We've had amazing feedback and we allowed the meeting to go on longer. We could go on all evening, I'm sure, but we hope to see you at future web meetings coming up. I'd like to thank all of our speakers, in particular our two members of Parliament, Paula Barker and Navendu Mishra, for being with us and for the work that you do. I'd like to thank Her Excellency Bárbara Montalvo Alvarez for the wonderful work you are doing in the UK in very difficult times at the moment, and we will continue our working together. And of course, I would like to give a wonderfully warm thanks to His Excellency José Ramon Cabañas for your forthright and exceptional contribution to this meeting. So thank you very much for your time, and thank everybody for being with us this evening. Viva Cuba, and we hope to see you again soon. Thank you.
Absolutely.